And in health news this morning, when it comes to your veins and arteries, vascular surgeons treat all types of blood vessels outside of the brain and the heart. And many of the same risk factors that contribute to heart disease cause vascular diseases. One important disease is aortic aneurysm disease, or AAA. Dr. Joshua Greenberg, vascular and endovascular surgeon from Mercy Health Physician Partners Vascular Surgery, is here to talk to us about treating AAA with minimally invasive surgery. Good morning. Thank you so much for being here with us.
Thanks for having me.
I mean, for something that sounds so serious, you know, the minimally invasive part of that we'll get to in just a moment.
Sure.
It's pretty amazing. But let's talk about what is abdominal aortic aneurysm.
Yeah, abdominal aortic aneurysm, or AAA, is essentially a dilation of the aorta, which is the biggest blood vessel in the body. Mm-hmm. And it's a condition that many people don't know they have, okay. And it's very treatable. And if it's not treated, it can be lethal.
Sure. And you have some percentages down here. I want to make sure I kept this paper close to me. But do you want to throw some figures out there at all, as far as men, women, who this affects, and?
It's far more common in men, although we do see it in women. Mm-hmm. About 200,000 people a year are diagnosed with it, and it's actually as common as about 1 in 10 people over the age of 65 have an abdominal aortic aneurysm and might not even know it.
All right. Are there some contributing factors to someone who might be in a higher risk category?
Sure. Well, you know, I always tell my patients that the risks of abdominal aortic aneurysm are smoking, and smoking, followed by high blood pressure, male gender. Smoking is such a prominent risk for it, and it's really obviously modifiable.
Okay. So. There's got to be some signs that point to a possibility of having AAA. Do you want to run down through some of the symptoms?
Believe it or not, the most common symptom is that there is no symptom. But if you do have symptoms, that could be the sign that it's stretching, growing rapidly, or even rupturing. And you'd want to get emergency medical care right away. But most people don't have symptoms whatsoever until often it's too late.
But sometimes there might be a little pulsating feeling, I'm understanding?
Yeah, it's true. If the aneurysm is large enough, you might actually be able to feel a pulsation in your lower belly. And if you're, I shouldn't say lucky, but I guess if you're lucky enough and you start feeling some belly pain or back pain, it could be a sign that something's happening.
Sure, sure. I guess what determines then if you're able to go ahead and start treating somebody for this?
What really determines it is the anatomy, how complicated the aneurysm looks, as well as whether you're medically healthy enough to have something, to have it fixed. These days we can really fix aneurysms in most people, even with very minimally invasive techniques.
Yeah, why don't you go ahead, if you don't mind breaking down we hear about aneurysm. Yeah. What exactly is happening when someone gets an aneurysm?
Well, an aneurysm can actually be almost in any blood vessel, usually an artery in the body, and it's a dilation. All it is the wall has weakened, and it's starting to get bigger over time. And as it gets bigger, it actually is more likely to grow from that point.
Sure. Any complications that come from somebody trying to ignore this?
The most common complication of aneurysms, either in the belly, which is what we're talking about today, or the chest, which are thoracic aneurysms, or the brain, is they burst. Sure. And if they burst, they can lead to bleeding and death. And
it sounds like you guys have a wonderful team in place that deals with this sort of thing, right?
Yeah. Very commonly we treat this condition very safely.
All right, so if someone wants to go ahead and go through the process of the minimally invasive process of getting this repaired, people are always worried about how long am I going to be away from my family? How long am I going to be away from my job?
Sure.
So.
Yeah, you know, these days people definitely want to get back to work quickly. The majority of people these days nationally, I would say 70 to 80% can be treated with minimally invasive techniques, with stenting. And that can basically, as you can see there, that's actually one of the more complicated stents. And in the illustration you see right there, on the left side of your screen is open surgery, and right there you see an aortic stent graft. Many people can go home the day after surgery with a stent. The olden days, you'd go home maybe a week or two later with the big open belly surgery. Yeah, so
these are some exciting advancements. You've got to love that when you see something like this, and so stuff's not always done the old way, right?
It's huge. People, I mean, I tell the story that sometimes patients will say to me in the recovery room, "Doc, when can you fix my varicose veins?" Yeah. After having had an aneurysm repair.
Wow.
So yeah.
All right. Well, thank you so much for stopping by
and
really opening our eyes to this problem.
My pleasure.
Thank you so much. And to learn more about Mercy Health Vascular Services, go to mercyhealthheartandvascular.com.